Title: Self-Reflection and Developing Insight for Healthcare Professionals in the UK. This is a section break. Introduction. Importance of self-reflection and developing insight for healthcare professionals in the UK is immense, and we will discuss about it briefly. What is self-reflection? Definition of self-reflection is the process of examining one's own thoughts, feelings, and actions to gain insight into oneself and improve personal and professional growth. Importance of self-reflection in healthcare. Self-reflection helps healthcare professionals to critically analyze their practice, identify areas for improvement, and develop strategies to enhance patient care. The role of self-reflection in personal and professional growth. Self-reflection promotes self-awareness, empathy, and compassion towards patients, and helps healthcare professionals to improve their practice. Why is self-reflection important for healthcare professionals in the UK? Unique challenges faced by healthcare professionals in the UK. Healthcare professionals in the UK face increased workload, complex cases, and burnout, which can impact their ability to provide quality patient care. Importance of self-reflection in managing these challenges and improving patient care. Self-reflection helps healthcare professionals to manage their workload, prioritize patient care, and enhance the quality of care provided. Developing insight. Definition of insight is the ability to understand the underlying causes of a problem, identify patterns, and make informed decisions. Importance of developing insight in healthcare. Developing insight helps healthcare professionals to understand the root causes of problems, identify areas for improvement, and develop effective solutions. How self-reflection helps in developing insight into practices and identifying areas for improvement. Self-reflection helps healthcare professionals to analyze their practice, identify patterns, and develop insights into the causes of problems. The benefits of self-reflection and developing insight. Improved decision-making. Self-reflection and developing insight improve healthcare professionals' ability to make informed decisions, prioritize patient care, and manage workload effectively. Personal growth. Self-reflection and developing insight promote personal growth, self-awareness, and empathy towards patients and colleagues. Enhanced patient care. Self-reflection and developing insight enhance the quality of patient care provided by healthcare professionals. Theoretical frameworks. Theoretical frameworks for self-reflection. John Dewey's reflective thinking model and Gibbs' reflective cycle. John Dewey's reflective thinking model. Dewey's model comprises 5 stages. 1. Identifying a problem. 2. Collecting information. 3. Analyzing the information. 4. Generating possible solutions. And 5. Evaluating the solutions. Gibbs' reflective cycle. Gibbs' cycle comprises 6 stages. 1. Description of the situation. 2. Feelings about the situation. 3. Evaluation of the experience. 4. Analysis of the experience. 5. Conclusion. And 6. Action plan. Strategies for self-reflection and developing insight. Reflective journaling. Writing down thoughts and experiences in a journal to gain insights into one's practice. Seeking feedback from peers and patients. Getting feedback from colleagues and patients to identify areas for improvement. Mindfulness practices. Practicing mindfulness to increase self-awareness and reduce stress. Importance of regular self-reflection and learning from experiences. Regular self-reflection helps healthcare professionals to gain insights into their practice and learn from their experiences. Case Study 1. Identifying Learning Opportunities. Case study on identifying learning opportunities through self-reflection. Patient X is a 65-year-old male who was recently diagnosed with hypertension. During his last visit, the healthcare professional noticed that patient X was hesitant to take his medication and was not following the prescribed diet. The healthcare professional used self-reflection to analyze the situation and identified the need to provide patient education on hypertension management. Through self-reflection, the healthcare professional identified the learning opportunity and developed a plan to provide patient education on hypertension management, which resulted in improved patient adherence to treatment. Case Study 2. Improving Communication Skills. Case study on improving communication skills through self-reflection. Healthcare professional Y had a patient who was anxious and nervous about the procedure. The healthcare professional realized that their communication style was not effective in calming the patient down. Healthcare professional Y used self-reflection to analyze the situation and identified the need to improve their communication skills. Through self-reflection, healthcare professional Y identified the need to provide more reassurance and empathy to the patient, which resulted in improved patient satisfaction and experience. Strategies for developing insight. Reviewing patient cases and analyzing the decision-making process to gain insight into one's practice. Peer review, seeking feedback from colleagues on one's practice to identify areas for improvement. Continuing education and professional development, participating in professional development programs to learn about new practices and enhance one's knowledge and skills. Reflecting on patient outcomes to gain insight into one's practice and identify areas for improvement. Barriers to self-reflection and developing insight. Lack of time. Healthcare professionals often face time constraints, which can limit their ability to engage in self-reflection and professional development. Fear of judgment. Healthcare professionals may be hesitant to engage in self-reflection due to fear of judgment from colleagues or supervisors. Lack of support. Healthcare professionals may not receive adequate support from their organization or colleagues to engage in self-reflection and professional development. Overcoming barriers to self-reflection and developing insight. Time management. Healthcare professionals can schedule time for self-reflection and professional development to overcome time constraints. Cultivating a culture of learning and growth. Healthcare organizations can promote a culture of learning and growth by providing support and resources for professional development. Seeking feedback from colleagues and supervisors. Seeking feedback from colleagues and supervisors can help healthcare professionals overcome the fear of judgment and identify areas for improvement. Conclusion. Recap of the importance of self-reflection and developing insight for healthcare professionals in the UK. Recap of the benefits of self-reflection and developing insight, as well as strategies for overcoming barriers to self-reflection and professional development. Encouragement to engage in regular self-reflection and professional development to enhance patient care and personal and professional growth. You may refer to above for further reading. Let's start with MCQs. What is self-reflection? A. A technique to avoid responsibility. B. An introspective examination of one's thoughts and emotions. C. A form of procrastination. Answer B. Why is self-reflection important for healthcare professionals? A. It helps them avoid mistakes. B. It helps them develop insight into their practice. C. It helps them save time. Answer B. What is the first step in self-reflection? A. Identifying the problem. B. Analyzing the problem. C. Accepting responsibility for the problem. Answer A. What is insight? A. A form of intuition. B. A deep understanding of a situation. C. A random thought. Answer B. What are the benefits of developing insight? A. It improves patient care. B. It increases revenue. C. It reduces stress. Answer A. What is an example of a barrier to self-reflection and developing insight? A. Fear of judgment. B. Too much free time. C. Lack of self-confidence. Answer A. How can healthcare professionals overcome the barrier of lack of time for self-reflection and professional development? A. By scheduling time for self-reflection and professional development. B. By avoiding self-reflection and professional development. C. By delegating tasks to colleagues. Answer A. What is an example of a strategy for developing insight? A. Ignoring patient outcomes. B. Participating in continuing education programs. C. Avoiding peer review. Answer B. What is an example of a negative consequence of not engaging in self-reflection and professional development? A. Reduced patient satisfaction. B. Increased revenue. C. Decreased workload. Answer A. What is the ultimate goal of self-reflection and developing insight? A. To increase revenue. B. To improve patient care. C. To reduce stress. Answer B. What is the first step in developing insight? A. Analyzing patient outcomes. B. Reflecting on one's practice. C. Seeking feedback from colleagues. Answer B. What is an example of a way healthcare organizations can support self-reflection and professional development? A. By limiting access to educational resources. B. By encouraging a culture of learning and growth. C. By promoting a competitive work environment. Answer B. What is an example of a way healthcare professionals can overcome the fear of judgment when engaging in self-reflection? A. By avoiding self-reflection altogether. B. By seeking feedback from colleagues and supervisors. C. By blaming others for mistakes. Answer B. What is an example of a way healthcare professionals can reflect on patient cases to gain insight? A. By ignoring patient outcomes. B. By reviewing decision-making processes. C. By avoiding patient interaction. Answer B. What is the ultimate goal of self-reflection and professional development for healthcare professionals? A. To increase workload. B. To improve personal and professional growth. C. To decrease revenue. Answer B. Thank you for time and attention. Contact information for further discussion or questions.